How are you everyone? Today I will discuss a new subject, the inguinal canal. To understand the inguinal canal, I want to discuss first bones and muscles in the area of inguinal canal. At the beginning, I want to discuss parts of hip bone. Hip bone have three parts here. This larger part is called ilium, and this is pubis, and this part called ischium. Again, the larger part here is ilium, pubis, and ischium. We have two hip bones here, left and right. The two hip bones meet in the symphysis pubis in the midline in front like this. This is called symphysis pubis. So the two hip bones meet in the pubis here. This we call this ilium, and this pubis. Pubis and pubis meet in the symphysis pubis here. I want to discuss some simple parts here. The ilium has crest here. It's called iliac crest. This margin up here. The crest end anteriorly and the anterior superior iliac spine. Anterior ilium. So related to ilium is iliac. Iliac spine, anterior superior iliac spine. This is pubis. The pubis here has upper end. We have pubic tubercle. Between pubic tubercle and symphysis pubis, this area or this part called pubic crest. So this is iliac crest. This is pubic crest. Okay. Pubic tubercle, pubic crest. The pubis has body and superior ramus and inferior ramus. So the pubic tubercle and the crest on the body of pubis, on the upper end of the body of pubis, and this is pubic crest, the superior pubic ramus. Sorry. On the superior pubic ramus, here we have a line called pectineal line. Again, body of pubis, superior pubic ramus, inferior pubic ramus. On the body of pubis here we have pubic tubercle and the crest. And on the superior pubic ramus, this is called pectineal line. Pectineal line here. Okay. Muscles in this area, we have three flat muscles on the anterior lateral abdominal wall. Very important here. This muscle called the outermost muscle is external oblique here. Deep to external oblique we have internal oblique. This internal oblique. Then transversus abdominis. Again, we have three flat muscles here, very important here. External oblique, internal oblique, and when we remove this, transversus abdominis. I will show you this in small diagram, simple diagram here. We have here this simple diagram about the muscles. This is the iliac crest here. Symphysis pubis, pubic crest and tubercle. Sternum here and the five process. Between the five process and symphysis pubis, this is called linea alba. Okay. Linea alba means white line. Alba means white, linea means line. Okay. And the flat muscles here, external oblique, internal oblique. When we remove external oblique, we find this muscle, internal oblique, and after removing internal oblique, we find transversus abdominis. Okay. Oblique muscle directed down and the medial, external oblique. Internal oblique up and the medial, oblique. Transversus fibers run horizontally like this. I don't want to give you very so much details here. I want to just discuss the inguinal canal. In the lower part of external oblique here, we find this part is inguinal ligament. The external oblique has fleshy fibers like this and aponeurosis. The beginning of the muscle is fleshy, flesh here, and this is aponeurosis, flat tendon of the muscle. The lower part of the aponeurosis of external oblique extends from anterior superior iliac spine and pubic tubercle. We call this inguinal ligament. Okay, so part of external oblique extends from anterior superior iliac spine and pubic tubercle is called the inguinal ligament. And from upper surface of inguinal ligament, there is fibers of internal oblique, make like an arching fiber like this. This is called lower arching fibers of internal oblique. Lower arching fibers of internal oblique arise from the lateral 2/3 of inguinal ligaments. Okay, make arching like this, and the end of this arch is the conjoint tendon here. This is the conjoint tendon. So the arching fibers arise from the inguinal ligament. I want to remind you, the inguinal ligament is part of external oblique, okay? And the arching fibers of internal oblique, this is the internal oblique, arises from upper surface of inguinal ligament. This is the inguinal ligament. From upper 2/3 of, from lateral 2/3 of inguinal ligament, at the end and at the edge of this arching fibers we have conjoint tendon. If we look here, we have space here, you see, between the arching fibers of internal oblique and inguinal ligament here. We call this space inguinal canal, okay? I will show you now a small model to understand this. So this is arching fibers of internal oblique, and this is a conjoint tendon. When removing internal oblique, we find this, transversus abdominis. The lower part of transversus also, we have an arching fibers also like this. Arises from the inguinal ligament, from lateral 1/3 of inguinal ligament, and this arching fiber end also in conjoint tendon. This is arching fibers of transversus abdominis, okay? So we have two arching fibers here, arching fibers of internal oblique and arching fibers of transversus abdominis, okay? Two arching fibers and one conjoint tendon. These two arching fibers of internal oblique and of transversus, the two arching fibers unit to form the conjoint tendon, and this, if you see here, the conjoint tendon attached to pubic crest and pectineal line. Remember, this is the pubic tubercle, the conjoint tendon here attached to the pubic crest and to the pectineal line. Also, between the arching fibers of transversus abdominis and the inguinal ligament, we have this space called inguinal canal. So in the area of inguinal canal here, look here, this is the region of inguinal canal. We have aponeurosis of external oblique muscle, arching fibers of internal oblique, arching fibers of transversus abdominis, okay? In the lower medial part of external oblique, we have an opening here. This opening called inguinal ring. We call this superficial inguinal ring. Okay, we call this ring, where we say superficial, so there must be deep inguinal ring, okay? After removing external oblique and internal oblique and transverse, we find a layer, another layer called fascia transversalis. This is deep, this layer is deep to transversus abdominis. And this is the inguinal ligament here. If we measure the distance between anterior superior iliac spine and symphysis pubis, and point this and make a point in the middle, on the midway between anterior superior iliac spine and symphysis pubis, in the middle of this we have a point called mid-inguinal point, and this called fascia transversalis, remember? Above mid-inguinal point we have a ring here, an opening in fascia transversalis, half an inch above the mid-inguinal point. This called deep inguinal ring. So we have here in the lower medial part of external oblique, we have superficial inguinal ring, and above inguinal ligament here we have deep inguinal ring, opening in fascia transversalis. So the deep inguinal ring in fascia transversalis, superficial inguinal ring in external oblique aponeurosis. The superficial inguinal ring in the lower medial part of external oblique aponeurosis here, and the deep inguinal ring in the fascia transversalis. What is the actual position, the exact position of the deep inguinal ring above the inguinal ligament? Where exactly? Above the mid-inguinal point. What is the mid-inguinal point? Point midway between anterior superior iliac spine and symphysis pubis here. If we measure the distance between anterior superior iliac spine and symphysis pubis, and midway between the 2 points here, this is the mid-inguinal point. Above this point, by half an inch, we have the deep inguinal ring. Okay. So in this model, I will show you these layers of lower part of anterior abdominal wall. Again, this is a hip bone. The hip bone here is the ilium, iliac crest, anterior superior iliac spine. This is pubis, and this is pubic tubercle and pubic crest. And here is the pectineal line. This is the pectineal line. We have foramen here called obturator foramen. External oblique aponeurosis. The direction is lower, down, and medial like this. In the lower medial part of external oblique aponeurosis, we have superficial inguinal ring here. This ring is a base formed by the pubic crest. I have two borders here called, each border called crus, medial crus and lateral crus. The medial and lateral crus is formed by the aponeurosis of external oblique muscle. And from the middle of the inguinal ligament, we have fibers like this, you see, perpendicular on the direction of the external oblique aponeurosis, fibers like this, called, we find here medial crus and lateral crus. So this fiber is called intercrural fibers. Intercrural fibers support the superficial inguinal ring. So the superficial inguinal ring in the lower medial part of external oblique aponeurosis has two crura, medial crus and lateral crus. Crus means limb and limb, you know. And the base of the crura, or the base of the ring, is formed by the pubic crest. When removing this external oblique muscle, I want to show first you, this is the inguinal ligament, you see here. The inguinal ligament down from its lower part is convex like this, you see. The inguinal ligament is reflection from the external oblique, down, back and upward like this. This is the inguinal ligament, you see. Okay. Also we have expansions of inguinal ligament like this in the medial part. We call this part of inguinal ligament is called lacunar ligament, and pectineal ligament here like this. All these are parts of inguinal ligament. This is the main part of inguinal ligament. We call it inguinal ligament proper. And this is a lacunar ligament. This is a pectineal ligament here like this. And from the medial part of inguinal ligament also, behind superficial inguinal ring, and another expansion of inguinal ligament like this. We call this reflected part of inguinal ligament. So the inguinal ligament has three expansions. Again, this is lacunar ligament, pectineal ligament, and the reflected part. So the reflected part behind the superficial inguinal ring like this. Reflected part of inguinal ligament. Layers again in this part is external oblique, internal oblique, and transversus. So when we remove the external oblique like this, we find the arching fibers of internal oblique, you see here. This is arching fibers of internal oblique. And after this, we find the arching fibers of transversus abdominis. If you find this, the internal is more wider because arises from upper 2/3 of inguinal ligament, and the transversus is more smaller because arises only from 1/3 of inguinal ligament. So this is arching fibers of internal oblique and transversus abdominis. Two arching fibers, you see, and the two arching fibers unite together at the end, forming the conjoint tendon here. This is the conjoint tendon. One conjoint tendon and two arching fibers, you see. Two arching fibers and one conjoint tendon. And this again, layers external oblique, internal oblique, transversus abdominis, and fascia transversalis. You see this fascia transversalis. And we have here, this is the deep inguinal ring. This is the deep inguinal ring. Okay, if you remember the deep inguinal ring above the inguinal ligament, okay, half an inch above the mid-inguinal point. So where is the inguinal canal here? This is superficial inguinal ring, and it is the deep inguinal ring, and this is the lower part of anterior abdominal wall. Okay, the inguinal canal present in the lower part of the anterior abdominal wall, oblique passage. How like this? You see, this is the inguinal canal like that. See here. So this is the deep inguinal ring. This is superficial inguinal ring. This is inguinal canal, extends from deep inguinal ring to superficial inguinal ring. Deep inguinal ring of fascia transversalis here to superficial inguinal ring in the external oblique aponeurosis. The distance between the deep inguinal ring and superficial inguinal ring about 1.5 inch or 4 centimeters. So the length of the inguinal canal is measured by measuring the distance between the deep inguinal ring and the superficial inguinal ring. We call this the inguinal canal. And also, if you see what is the cover of the inguinal, or I mean of the roof of the inguinal canal, what is the roof here? Is the arching fibers of internal and transversus. You see here, this is the arching fiber forming roof for inguinal canal. Here, like this. And about the floor of inguinal canal, this inguinal canal rests on the inguinal ligament, the upper surface of inguinal ligament, and this part also, lacunar ligament. So the floor of the inguinal canal is formed by the inguinal ligament and lacunar ligament here, you see. This is lacunar ligament and this is the inguinal ligament. This is the floor of the inguinal canal. What about the anterior wall of inguinal canal? I want to see. If you see this forceps here, like this, what is in front of it? The anterior wall is formed by external oblique aponeurosis and the arching fibers of internal oblique on the front of the deep ring like this. This is the internal oblique. Why not transversus? Because transversus is small. The anterior wall of inguinal canal here is formed by external oblique aponeurosis and internal oblique arching fiber of internal oblique, the beginning of arching fiber. Okay, this. See, what about the posterior wall? Posterior wall is formed by the reflected part of inguinal ligament, the conjoined tendon here, the posterior wall, and this is the fascia transversalis. You know, again, inguinal canal, the lower part of anterior abdominal wall, extends from deep inguinal ring to superficial inguinal ring. We understand here that the roof of the inguinal canal formed by the arching fibers here of internal and transversus. Floor of inguinal canal down here by inguinal ligament and lacunar ligaments. In the second video, I will discuss for you more boundaries about the anterior wall and the posterior wall, and what are the types of inguinal hernia that arise in this area of canal. In this video, I will discuss for you boundaries of inguinal canal. This is the lower part of anterior abdominal wall. This is external oblique muscle. Direction of fiber directed downward and medial like this. In the lower medial part of external oblique, we have superficial inguinal ring. Inguinal ligament is the lower part or lower border of external oblique aponeurosis. Expansions of inguinal ligament, lacunar ligament, pectineal ligament, and we have here behind superficial inguinal ring the reflected part of inguinal ligament. You can see the previous video discussing the introduction of the inguinal canal. And after the external oblique aponeurosis, behind external oblique aponeurosis, we have arching fibers of internal oblique like this, and the arching fibers of transversus abdominis. We see that the arching fibers of internal oblique are more wider or broader than the arching fibers of transversus, because the internal oblique arises from the upper 2/3 of inguinal ligament, while transversus arises from the lateral 1/3 only. Okay, So this muscle, internal oblique, arises from 2/3 of inguinal ligament, and this arises from 1/3 only. The arching fibers of internal and transversus abdominis unite together, forming the conjoint tendon like this. Behind the arching fibers of transversus, we have fascia transversalis, and in fascia transversalis we have the deep inguinal ring. So we have here superficial inguinal ring, and that is a deep inguinal ring. Now I want to see what about the roof and floor of inguinal canal. Inguinal canal extends from deep inguinal ring to superficial inguinal ring like this. Okay, this is the inguinal canal from deep inguinal ring to superficial inguinal ring. So roof of inguinal canal is formed by the arching fibers of internal and transversus. Floor of inguinal canal is formed by the inguinal ligament, the medial part of inguinal ligament like this, and lacunar ligament, the upper surface of lacunar ligament. We call the upper surface abdominal surface, and we call the lower surface femoral surface, because this is the thigh directed toward the thigh. So the floor of inguinal canal is formed by the upper surface of inguinal ligament and the lacunar ligament here. This is about the roof and floor, okay? Roof arching fibers of internal oblique and transversus, and the floor is formed by inguinal ligament and lacunar ligament. What about the anterior wall and the posterior wall? To understand the anterior and the posterior wall, I want to make a cross or transverse section through the inguinal canal. I cut like this, okay? So when I cut like this, I will remove the arching fibers here. I just see the beginning of the arching fibers in this section like this, and the conjoint tendon at the end like this. And we have a line here. This is external oblique, aponeurosis, and superficial inguinal ring, internal and transversus, conjoint tendon, and this is the fascia transversalis. Don't forget this. This is the reflected part of inguinal ligament. You understand this, okay? I will cut transversal like this. You see here. So this is external oblique and superficial inguinal ring. See here, external oblique and superficial inguinal ring. After this, after we cut, this is the reflected part of inguinal ligament behind the superficial ring. If we look here, this is the reflected part of inguinal ligament behind superficial inguinal ring. And internal oblique and transversus abdominis, okay? The beginning of the arching fiber like this. The more wider is internal oblique, the narrow fibers is transversus abdominis here. This is internal oblique and this is transversus abdominis, okay? The internal oblique and transversus abdominis form the conjoint tendon here. Remember that the conjoint tendon behind the reflected part of inguinal ligament here, the conjoint tendon behind the reflected part of inguinal ligament. And after all of that, we have fascia transversalis here with deep inguinal ring. So we here have, this is fascia transversalis, and there is a deep inguinal ring, okay? So this cross section through inguinal canal. Again, I want to review this cross section. We understand the roof and the floor, okay? Again, don't forget the roof is formed by the arching fibers, okay, of internal and transversus, and the floor is formed by the inguinal and upper surface of lacunar ligament. Inguinal ligament and lacunar ligament. Again here. So this is the external oblique muscle, external oblique, aponeurosis, reflected part of inguinal ligament, conjoint tendon, fascia transversalis. What about this? Internal oblique, transversus abdominis, and this is the deep inguinal ring here, and this is a superficial deep inguinal ring here, and this is a superficial inguinal ring. Where is the inguinal canal? This is the inguinal canal, okay? This is the inguinal canal. I want to understand this, the inguinal canal. From deep inguinal ring to superficial inguinal ring, okay? What are the boundaries? We have here the anterior wall of inguinal canal and the posterior wall. Where is the anterior wall? We have, this is the anterior wall of inguinal canal, and that is the posterior wall of inguinal canal, like this. Posterior and anterior wall. Anterior wall is formed by external oblique aponeurosis and internal oblique. Transversus abdominis is not included in the anterior wall because narrow fibers. In front of the rib ring is internal oblique, the more wider fibers, okay? So the anterior wall of inguinal canal is formed by external oblique muscle and the internal oblique, like this. While the posterior wall is formed by this reflected part of inguinal ligament, small part, more larger, conjoint tendon, and the whole of the posterior wall is formed by fascia transversalis. So we have three structures in the posterior wall, two structures in the anterior wall. Three structures in the posterior wall are reflected part of inguinal ligament, conjoint tendon, fascia transversalis. Two structures in the anterior wall, we have the external oblique aponeurosis, and this is the internal oblique. Transversus not included in the anterior wall. What is the inguinal canal? This is the inguinal canal. What about the contents of the inguinal canal? Here we have in male spermatic cord, like this, from deep inguinal ring to superficial inguinal ring, and ilioinguinal nerve. The ilioinguinal nerve run between internal oblique and transversus abdominis, entering the inguinal canal and coming out through the superficial inguinal ring. So, and in female we have also round ligament of uterus and ilioinguinal nerve. So this is in male or female ilioinguinal nerve. The ilioinguinal nerve does not come through the deep ring, okay? Come through the space between internal oblique and transversus and enters the inguinal canal, like this, and comes out through the superficial inguinal ring. What about this structure? Male or female? In male, this is spermatic cord, okay? In female, round ligament of uterus. So if someone asks you what are the contents of the deep inguinal ring, in female or male, only one structure. I mean, one spermatic cord is not one structure, you know, 9 structure together, but I mean collectively spermatic cord, okay? In male, spermatic cord. In female, round ligament of uterus, only through deep inguinal ring. What about the contents of the superficial inguinal ring, or structure passing out through superficial inguinal ring? We have spermatic cord and ilioinguinal nerve. What about in female? Deep ring, round ligament of uterus. Superficial ring, round ligament of uterus, and the ilioinguinal nerve. What are the contents of inguinal canal? Both structures, ilioinguinal nerve, and in male spermatic cord, and in female round ligament of uterus. In next video I will discuss for you another subject, the inguinal triangle, okay? This is very important to understand the types of inguinal hernia. I hope you understand the boundaries of inguinal canal. Thank you. How are you, everyone? In this video I will discuss the different types of inguinal hernia. To understand this video, you must watch video of inguinal canal introduction and inguinal canal boundaries and inguinal triangle. You remember this? We have this inguinal triangle, if you remember, boundaries by the inferior epigastric artery and lateral border of rectus sheath and medial half of inguinal ligament. And this is a deep inguinal ring. This zero structure is fascia transversalis, if you remember in this video before. This is deep inguinal ring. On the medial border of deep inguinal ring, we have this inferior epigastric artery, arching fibers of internal and transversus abdominis, internal oblique and transversus, forming the conjoint tendon, obliterated umbilical artery from the umbilicus to the pelvis, and this artery divides the inguinal triangle into medial half and the lateral half. The medial half supported by conjoint tendon and fascia transversalis, while the lateral half contain only the fascia transversalis. If we make cross section in this triangle like this, or this inguinal area as all, we will find the inguinal canal also. You remember, if you see the video of boundaries of inguinal canal 2, you will watch you will see like this. You remember, this is external oblique muscle, external oblique, aponeurosis, and this is the superficial inguinal ring, the beginning of arching fibers of internal oblique and transversus abdominis. The two fibers form the conjoint tendon, and this is the reflected part of inguinal ligament. And most posterior we have this fascia transversalis and the deep inguinal ring. Of course, in male, this is spermatic cord through deep ring to superficial ring like this, and this is the ilioinguinal nerve. When we see this diagram, if we make a cut section here like this, we will also see this artery and this obliterated umbilical artery, inferior epigastric artery, medial to the deep ring. This is the deep inguinal ring, so this is the inferior epigastric artery here, you see it like this. And also this is the obliterated umbilical artery behind like this. This is the area of inguinal triangle, you see. So the inferior epigastric artery, medial to the artery, this is the inguinal triangle, you see here. So this is the area of inguinal triangle. This is the floor of inguinal triangle formed by fascia transversalis and conjoint tendon. You can see in this diagram. We have two types of hernia. We have kind called indirect inguinal hernia that pass through deep inguinal ring to superficial inguinal ring. Indirect. Okay. And have direct type. So the indirect hernia come through the deep ring, inguinal canal, superficial ring. We call this indirect or oblique. We have here a spermatic cord, so the indirect type pass through spermatic cord. Okay, because the cord starts from the deep inguinal ring. While the direct inguinal hernia pass through the inguinal triangle. So if you see here, this is obliterated umbilical artery. If it comes through here or through here, through the medial to the obliterated artery, this is called medial direct, or lateral to the artery is called lateral direct. At first, to understand the indirect hernia, I want you to watch this video, okay? Wait. This one. Yes, we'll start again here like this. This simple diagram shows that it is the abdominal cavity, and this is a scrotum here, and this is the inguinal canal. We have this peritoneum here in this area. Testes developed in the posterior abdominal wall behind the peritoneum like this. After this, the testes descend to the scrotum. If you watch here, this descend of testes like this. This is the inguinal canal, deep inguinal ring, superficial inguinal ring, and scrotum. So when testes reach the deep inguinal ring here, the peritoneum gives a process like this called the processus vaginalis. So this is a process from the peritoneum come with testes to the scrotum like this. After this, this process come with testes into the scrotum like this, you see. We call this processus vaginalis, connected with peritoneal cavity and the testes and the scrotum now. After the testes completely descend into the scrotum, this processus vaginalis has distal part and proximal part. The distal part remain patent, open like this, and form what is called tunica vaginalis, while the proximal part obliterated, and we call this vestige of processus vaginalis. So you can see after this complete descent of testes like this. So this is the vestige of processus vaginalis, and this is the tunica vaginalis. Okay. If these processes remain patent like this, you must understand that processes pass through inguinal canal. Okay. This way the intestine is here, so the intestine will come through this defect to the scrotum, and we call this congenital inguinal hernia. Congenital indirect inguinal hernia. You mean congenital indirect due to failure of obliteration of processus vaginalis. the vestigia remain patent, or process remain patent, and the intestine come into the scrotum. We call this congenital indirect inguinal hernia. I will show you this also in this video. You can see like this. You see here again. This is the intestine, okay? And this is the processus vaginalis, and tunica vaginalis is the testis. This is the inguinal canal, you see here. Remember, fascia transversalis, peritoneum, parietal peritoneum here, and this is the processus from peritoneum, fascia transversalis, and deep inguinal ring, internal oblique, transversus, external oblique, conjoint tendon, reflected part. The intestine pass through the non-obliterated processus vaginalis into the scrotum. You see here, this is a congenital indirect inguinal hernia. You can see here again, like this, pass through the processus vaginalis, like this, again, again. See, this kind of hernia of congenital type passed to the scrotum. See, like this. This is a congenital indirect. We can also find this kind of hernia may be stopped in the inguinal canal like this, not come through the superficial ring. We call this biobonoceal. This is a kind of indirect hernia. So the intestine or hernia stop in the inguinal canal, biobonoceal. And if the hernia comes through the superficial ring like this, reach only the neck of the scrotum, here, like here. Okay, we call this funicular type of indirect inguinal hernia. Or completely descent into the scrotum, we call this complete type of indirect inguinal hernia. So in indirect type, we have if the hernia stop in the inguinal canal, we call this biobonoceal. If come out through the superficial inguinal ring and stop at neck of scrotum, we call this funicular type. If completely descent into the scrotum to the testis like this, we call this complete indirect type. So this is a congenital type. Why? What is the cause of this congenital type? I told you, failure of fusion of processus vaginalis. You see here, this is processus vaginalis, and this processus not obliterated like here in this area. Okay, so the intestine comes through this defect. The congenital type. Okay, what about the acquired type? You can see also another video like this. Stop. In the acquired type, this is the intestine. The processus vaginalis completely obliterated like this, and this is the tunica vaginalis. Okay, the intestine push the parietal peritoneum here. Okay, we and form what's called Pulsion Sac. You see, acquired Pulsion Sac. You see here, like this. See the intestine. So the intestine not come through the processus vaginalis here. It come through the beside the process within the contents of the spermatic cord. You see here. We call this kind of peritoneum here that pushed like this acquired Pulsion Sac. You see. Also may stop in the inguinal canal, biobonoceal, may come out through superficial ring and stop at neck of scrotum. We call this funicular type, or descend completely into the scrotum. Okay, this called acquired indirect inguinal hernia. So we have congenital indirect and acquired indirect. Okay, the difference: the acquired form special sac, separate sac inside the spermatic cord, while the congenital type pass through the processus vaginalis, the failed obliterated processus vaginalis. Okay. What about the direct type of inguinal hernia? Okay, so the direct type comes through this area, the floor of the inguinal triangle. If you remember this, I will show you again like this here in this video here. Okay, if you remember, this is a floor of inguinal triangle here, conjoint tendon and fascia transversalis. The medial part of inguinal triangle has fascia transversalis and conjoint tendon. The lateral part of inguinal triangle, fascia transversalis only. This is the inferior epigastric artery. This is the intestine. We also remember we have here obliterated umbilical artery in this part. Okay. This is the intestine. If the intestine comes through the lateral part of inguinal triangle, this is called lateral direct inguinal hernia. If the intestine comes through the medial part of inguinal triangle, we call this medial direct inguinal hernia. This lateral type commonly due to old age, the aging process, because degeneration in this fascia, this area become weak and the muscles also become weak. So the intestine comes through this triangle. So this type of hernia commonly bilateral. I will show you now the course of the intestine forward. You see here, we'll push the peritoneum and the fascia transversalis like this. You see, you understand the indirect type inside the spermatic cord, the direct type behind the spermatic cord. You see, this is the area of spermatic cord inside the inguinal canal. So the direct type here behind spermatic cord. Yes, this is the area of spermatic cord is behind it. It is a vestibule, if you remember, one of the contents of the spermatic cord. So this is the lateral direct inguinal hernia. The direction is forward. When we try to reduce this or make a reduction for this, backward, like direct backward like this. Okay, so this is the lateral direct type of inguinal hernia. So if you see also this kind of hernia or this type of hernia cannot pass through the scrotum because not passing through the superficial ring. This is away from superficial ring. So the lateral type cannot pass through the scrotum. Okay. If we see another video like this, the medial type here. What's the problem in medial type? You can ask me, this the medial half or medial part of inguinal triangle is supported by conjoint tendon. So for medial type to occur, must be trouble in this conjoint tendon. Yes, we have ilioinguinal nerve, you remember this. During appendectomy, the ilioinguinal nerve may be cut, or injury of ilioinguinal nerve. So there is a paralysis of this conjoint tendon and become weak. So if you see here, what will happen then? The intestine will push the peritoneum and fascia transversalis and the conjoint tendon and reflected part. You can see what will happen here. You see, intestine. This is a medial direct inguinal hernia. Push the peritoneum and conjoint tendon. Remember the conjoint tendon behind the superficial ring. See what will happen. So this kind of hernia may pass through the superficial ring. Yes, and may very rarely to pass into the scrotum, because pass through superficial ring may pass to the scrotum, but the lateral type never pass to the scrotum because away from the superficial inguinal ring. So we make a rapid review about types of hernias. This is the congenital indirect through processus vaginalis, remains because due to failure of fusion of obliteration of processus vaginalis. This is the congenital indirect. Okay, acquired indirect, acquired Pulsion Sac through the inguinal canal. Either the congenital or acquired type are inside spermatic cord, okay, and also inside inguinal canal, of course. And there is the lateral direct inguinal hernia through the lateral part of inguinal triangle here, and this is the medial direct inguinal hernia, push the paralysed conjoint tendon through superficial ring. I hope you understand the types of inguinal hernia. To understand this structure of inguinal canal also and the inguinal triangle, you can refer to the previous 3 videos: Inguinal Canal 1 Introduction, Inguinal Canal 2 Boundaries, and Inguinal Triangle. This is very important for you to understand the anatomy of the inguinal region. Okay, thank you for watching this video.